So most of you know that the DSM-4 and the TR just stands for text revision. So the DSM-4 identifies 5 pervasive developmental disorders, of which 3 have come to be known as the autism spectrum disorders. And those are autistic disorder, Asperger's disorder, and pervasive developmental disorder not otherwise specified, or PDD-NOS or PDD-NOS, depending on the terminology that you prefer. And those are the 3 in red that I will be focusing on today. All autism spectrum disorders have 3 core features. There is an impairment in social skills. There's an impairment in the communicative use of language, verbal and nonverbal. And there is the presence of restricted and repetitive behaviors that share a focus on details and an inability to grasp concepts. One of the distinctions that I think can be very confusing at times is that between autistic disorder and Asperger's syndrome. And you'll notice that since they both have the same initials, autistic disorder has come to be abbreviated as AD and Asperger's disorder as AS. And again, to just graphically point out the distinctions in the way we characterize them, both have social impairment, both have restricted and repetitive stereotyped behavior. Verbal communication is impaired in autistic disorder and not Asperger's syndrome, although there are many peculiarities, if you will, of language in Asperger's syndrome that we will discuss. And autistic disorder has clear-cut delay by age 3 and therefore is diagnosed much earlier than Asperger's disorder, and that is obviously lacking on the other side of the slide. In the 2 areas of distinction, communication, in autistic disorder, speech may be completely absent, or manifestations might be just impaired conversation. Echolalia is highly characteristic. Do you know what that is? You say, "How are you?" and the child responds, "How are you?" instead of "I'm fine." And lack of imitative play. Asperger's syndrome, again, no delay in language. And by language here, I'm really referring to grammar, syntax, vocabulary. Children with Asperger's syndrome are able to construct appropriate sentences and make themselves understood and communicate and understand. Autistic children will have delays in the spheres of social interaction, language, and symbolic play before age 3, and Asperger kids will not. Their cognitive development and self-help skills and adaptive behavior are all intact. Only their social interactions are delayed. And for PDD-NOS, again, the core social, communicative, and stereotypic features are present, but somehow they differ from true autistic disorder, and it can be in any one of these ways. The onset is later, the onset is atypical, or the symptoms are subthreshold, or any and all of those. So that's the sort of the term that's used when you can't comfortably say this is clear-cut, severe, classic autism, but it looks like it's on the spectrum to me. One question